Joining us now, great to welcome one of the co-authors of a very interesting book and timely as well. It's going to answer a lot of questions, I'm sure, for a lot of people, called The Human Cost of Welfare, How the System Hurts the People It's Supposed to Help. We're joined today by Lisa Conyers. She's the Director of Policy Studies for the DKT Liberty Project, and she's an expert in this field, and she joined us by telephone today. Lisa, good to talk with you. How are you?
Oh, I'm doing well. Thanks for having me.
Yeah, good to have a chance to chat for a couple of minutes. Had an opportunity to read through the book, and obviously we're in a political year again, and this is going to be one of the issues that always seems to be, particularly during an election, welfare reform. But sadly, what I guess was tried to be fixed a few years ago, I guess with welfare reforms, not quite doing the job, right?
No, we did have welfare reform back in '96, and the philosophy behind it was, we thought, quite good. We would, bring work back into the welfare system and tell people that, yeah, you can get welfare, but we're going to get you back into the workforce. And that did work well for a while, but sadly those days are gone.
Yeah, I know for a while it seemed to work okay, and I guess just the bureaucracy of government slowly and steadily, it just gets out of hand, and the budgets just get so high. It's more than just money, I know, throwing it at the problem, but it's a difficult problem to solve, isn't it?
It is, and the money is a part of the issue, but for us, we were more concerned when we were writing this book about the human cost of welfare and what it does to people who go on the systems. And what we looked at is the idea that work is so essential to human beings and so essential to human happiness, and yet the welfare systems, the way they're designed today, sort of tell people, don't go to work. Work is risky. If you go, you're going to lose everything. Just stay on the programs and don't work, or work part-time. And we just feel that that's the wrong way to go about things, that we should actually be trying to get people back to work.
I know years ago, my parents' era used to be called relief, and it was only intentional. The intention wasn't just to be a temporary thing to help people get back on their feet so they could get back to work. Somewhere along the line, it changed to a different name, welfare, which almost sounds like it's making you wealthy in a sense. I mean, it's not intended for that, right? Mm-hmm.
No, I think that, all of us want to do the right thing for people in need. Nobody likes to see somebody going hungry or homeless. And I think that we started these programs with the best of intentions, and it was supposed to be, helping people get back on their feet after troubles, or, people who really couldn't work, the disabled. And but it's morphed into something quite different. And it's interesting that you would mention language, because I traveled all over the country interviewing people on welfare for this book. And one interesting thing that I discovered was that word welfare is kind of going by the wayside. People don't use that anymore. They call it their assistance. Mm-hmm. They say, that's my assistance. So, we're even more changing the language to be less, less about, something temporary. It's just, hey, this is my help that I get. This is my personal assistance.
Yeah, I know you talk about in the book, like you said, it is a deterrent to work in a sense, because if you work part-time, let's say you are able to find some work and you make over a certain amount, you actually lose money because your welfare benefits or assistance is cut, so there's no incentive for you to make any money at all in some cases.
Well, and that's exactly right, and that's especially true of people that probably should be least incentivizing, and that's, young mothers, single mothers with children, because we basically put them in a situation where the value of their benefits, if you add in food stamps and public housing and utility help and a free telephone and medical care and nutritional supplements if you have small children in the home, and you add up the value of all that, it's very hard for a young woman in that position to find a job that can match all those benefits. And so we're actually building incentives into the system that say, hey, just stay where you are, don't take that job, because you're going to lose so much help. And we just feel that work should never be risky like that. It should always be better for people to go to work than not go to work, because at the end of the day, work makes you feel better as a human being. We all know that. In our heart of hearts, we know that the way to pursue happiness is to be working and contributing to society and taking care of your kids on your own and not depending on, a check to come in the mail. And yet we incentivize that very behavior.
Yeah, I think some of the numbers you had in the book, some people can make up to $40,000 a year and when you total everything up, which is not a terrible salary these days, right? I mean,
no, yeah. And it's really hard to match that, especially when you think about the demographics of who would be getting off of welfare and going into these jobs. It's not people who can go and apply for a $40,000 or $50,000 a year job. These are people that are going to be entering the entry-level jobs, simultaneously losing their benefits. It just makes no sense.
Yeah,
so you can understand why they choose not to do it. And I think that's wrong, not only in the short term but in the long run, because these people down the line are going to look back and say, what did I do with my life? And I heard that a lot on the road. I heard people say, I thought I was going to be part of the American dream. I was going to have that job and the house and the career and all that, and now I'm just sitting at home.
Do you find from the people you talk to, Lisa, like the work ethic? I know I was a kid, a lot of kids my age, when I grew up, you had a paper route, I did lawns. I mean, I don't know if kids are doing that anymore, where you develop kind of a work ethic. Your parents have to instill that in you as well, and I guess that's just not happening, right?
Well, and that, interestingly enough, I found that there is still a work ethic out there. It's just that the incentives are all messed up. I mean, I met even single moms with multiple children said, I would much rather be working and they would say things like, I wish my child would see me go to work because I don't want them to end up like me. I don't want them to end up thinking that this is how you live a life. I'd rather they see me bringing home a paycheck. But I just can't figure out how to make it work because, we're getting all these benefits right now, and I can't replace those. Yeah. And so the work ethic, I think, still is out there, but I don't know how long we can rely on that human spirit if we keep putting systems in place that teach them something different.
I know you talk about in the book some ideas to kind of get this on the right track. I know we don't have a lot of time today, but give one or two thoughts of how this can be at least attempt to be solved.
Right. Well, I think that there are so many different welfare programs that rather than tweak each one individually, I think the biggest takeaway from our chapter on recommendations is that anything that inspires people to go to work. So the biggest recommendation we have is topping off wages so that if you're willing to go to work full time, we'll make sure that you get enough to live on to make it worth it to do it, so that it makes work more attractive than welfare. Because anybody willing to go to work shouldn't be living in poverty, right? I mean, if you're willing to get up every morning and go to work, you should be rewarded for that. And so that's our biggest takeaway. And there are many ways to incentivize work, but what we want to do is inspire people to see that work is, they'll feel better if they go to work, and give them reasons to do so.
Yeah, good tips, and you have several in the book as well. And again, it's lays it kind of all out there for you, easy to understand. I know it's not always easy to understand all the bureaucracy of these programs, but you did a good job with it. And the name of the book is called The Human Cost of Welfare. I've been talking with Lisa Conyers, one of the co-authors. And Lisa, do you have a website you can direct people to get more information?
We do. We have a website called humancostofwelfare.com, and on that website you can find a coupon to use for a discount on the book at our publisher's website, the Prager Publishers. And, of course, the book is available on Amazon. And there will also be a documentary coming out this fall on PBS based on the book. So we're looking forward to that as well.
Great. Lisa, pleasure talking to you again. Good work, and hopefully we can do it again. Thanks for joining us today.
Great. Well, thanks for having me.
I'm Stan Brock. 30 years ago, I formed Remote Area Medical to help people overseas. But then we found generations of families in America isolated by poverty from the health care they need. Together, we can take dental, vision, and medical help to 1 million adults and their kids, right here at home in the United States of America.
If you'd like to order the book we're talking about, please go to DougMilesMedia.com and enter the author's name in the Amazon search box. Thank you for listening. Please come back soon for more conversations here at DougMilesMedia.com. This has been a presentation of Doug Miles Media, all rights reserved. You can listen to or download previous programs at iTunes, Stitcher.com, or Doug Miles Media.